So we will now move on to the second module of insulin, which is insulin regimen. So we have seen about the various insulins, short-acting insulin and the long-acting insulin. We'll briefly, it will take about 10 to 15 minutes of our time now to understand the various regimens which are available. So which is very, very important for us to discuss about the cases. We should have a thorough understanding of the various regimens available. So insulin secretion in the fasting state, insulin secretion is maintained so that it provides sufficient insulin to constrain hepatic glucose release at rates that match glucose utilization. So basically the insulin is secreted in the fasting state so that the plasma glucose concentration is maintained at level of 90 milligram per deciliter. So this is something which is constantly happening so that the blood sugar doesn't go in a basal condition above this, rather below this. So this is maintained. So to maintain this level, insulin is secreted on a very continuous fashion. This is one thing that we need to understand. The second thing that we need to know is after meal ingestion, glucose concentration in the circulation rise and stimulate insulin secretion. So whenever we take food, whatever we consume, you can consume even 10 portions of your normal meal, it doesn't mean that the glucose can rise. The insulin secretion happens in such a way that it proportionately rises for that 10 portions increase in the meal that you had consumed, so that it caps at that place, the postprandial blood sugar is capped at 160 or 180 for that individual. So two things we need to understand from these hypotheses or from these understanding, that one, the insulin is secreted in a basal phase, in a basal manner, in a continuous manner to maintain the blood sugar at about 90 milligram per deciliter. The second thing is whenever we consume meal, the insulin is secreted to compensate for that meal so that the postprandial blood sugar doesn't elevate in a higher way. So the insulin secretion is in response to the meal, in response to the whatever portions of food that we had consumed, so that the postprandial blood sugar is also capped at that way. So one is basal insulin, the other is prandial insulin. So from these understanding of fasting and the prandial insulin, we came into this concept called as, the first concept is basal. So any long-acting insulin, so it could be NPH, it could be glargine, it could be detimer, any insulin that is given in the basal state is called as a basal insulin. So this covers to keep the blood sugar fasting under 90 milligram per deciliter. So this is called as basal insulin. So the one which we take with food is going to be prandial insulin. So if you take an insulin for breakfast, if you take an insulin for lunch, if you take an insulin for a dinner, it is going to be prandial insulin. So two things we need to understand. One is basal insulin, the other is prandial insulin. Basal insulin can be glargine or it could be NPH. Given 2 times a day, it can be NPH. So this basal insulin, when they are given with the prandial insulin, it is called as basal bolus. So the correction can happen with the breakfast, with the lunch or with the dinner. That is called as basal bolus. Basal is giving glargine. Basal bolus is giving the meal correction. It is called as basal bolus. So these are the two important regimens that we need to understand.